Well, the hospitalization of Buffalo Bill's safety, Damar Hamlin, is shocking for so many reasons. Among them, how someone so young and seemingly healthy could suffer that cardiac arrest.
Yeah, the first moments after such an incident are critical for survival. So joining us now is Dr. Larry Phillips, former president of the American Heart Association in New York City. Thank you for joining us.
Great. Thank you for having me.
All right, doctor, let's jump right in and talk about how important were those first minutes after Hamlin collapsed for doctors and team members to administer CPR?
Yeah. Those first moments are really crucial. We know that the faster somebody starts CPR, activates the emergency medical system, and when appropriate has a defibrillator on site, the better the likelihood of survival. We know that those moments really count to start chest compressions, to circulate the blood and keep the organs supplied with needed oxygen.
I'm wondering, so he appears to be the picture of health. We obviously don't know everything, but we don't know right now of any underlying conditions he may have had. What do you think doctors at this point are they looking for?
Well, I don't have information about his specific clinical situation. I do imagine that they're doing a full assessment of both the structure and electrical activity of his heart, and also looking for any clues of what might have happened. It's important to know, though, when people have cardiac arrest, and it doesn't matter what age, it's usually a very acute process where they will suddenly collapse, and that immediately has to be recognized and treated. And the underlying cause is separate, but that abrupt treatment is really what makes a difference.
Okay, doctor, let's talk a little bit more about that. What are the most common causes of cardiac arrest, and is it the same thing as a heart attack?
So cardiac arrest is not the same as a heart attack. In a cardiac arrest, essentially the body is not receiving the needed amount of oxygen by blood because the heart is not able to pump appropriately. This will commonly be caused by an electrical reason, where the electrical system is not allowing the blood flow to be sent to the rest of the body. Because of that, all of your organs are at risk by being starved of oxygen. In a heart attack, you're talking about a blockage of one of the arteries supplying blood to the heart muscle. And that's why getting prompt care for a heart attack and undergoing procedures like catheterizations and stents are so important to stop the heart attack in its tracks right there.
Let me ask you, as we see something like this, and those are always reminders to people how important it is to learn CPR and to continue to be refreshed on a CPR training. Can you talk a little bit about the importance of that?
Yeah, absolutely. We know that over 350,000 cardiac arrests occur in the United States every year outside the hospital, with almost 90% of them being in the home or in the workplace. It's important that everybody take a couple of moments to learn hands-only CPR. So after calling EMS or 911, what you want to do is start pressing fast in the middle of the chest using both of your hands. Now, there are lots of very straightforward videos like the one you're seeing on cpr.heart.org through the American Heart Association, which within a couple of minutes teaches you the essentials of how to perform hands-only CPR. And we know that if CPR is started quickly, you can increase the chance of somebody's survival from a cardiac arrest by 2 or 3 times. So we have the power to make a difference by learning, being prepared, and then making a difference.
Yeah, thank you for that reminder.
Well, Dr. Larry Phillips with the American Heart Association, thank you so much for joining us.
Thank you.